Okay, let's get into it. We're doing a deep dive today on post-streptococcal glomerulonephritis, PSGN.
Right.
And we're working from some really helpful MSRA revision notes that a listener sent in designed to be high yield.
Yeah, very focused.
Exactly. So our aim here is to pull out the key facts, make it clear, make it memorable, especially if you're revising.
Sounds good. It's an interesting one, PSGN, because it's not the strep bacteria itself causing the kidney issue directly.
Ah, okay. So what is it then?
It's actually an immune-mediated thing. Inflammation in the kidneys, specifically the glomeruli, the little filters.
Mm,
And it typically happens, maybe 1 to 4 weeks after you've had a streptococcal infection.
like strep throat.
Exactly, strep throat, or sometimes a skin infection, usually group A, beta-haemolytic strep. And it tends to hit younger children more often.
Right. So the infection's gone, but then the immune system causes trouble. Why does it do that? Why the kidneys?
Well, that's the core pathophysiology, isn't it? It's about these things called immune complexes. So your body makes antibodies against the strep bacteria.
Mm-hmm.
These antibodies bind to leftover bits of the strep, the antigens, and they form these clumps immune complexes. And for some reason, maybe linked to the type of strep, these complexes get deposited in the glomeruli,
Lodged in the filters.
precisely. And once they're stuck there, they set off an immune reaction, activating the complement system,
Okay.
which basically causes inflammation and damage right there in the filters. And that damage means the kidneys can't filter properly, leading to problems with fluid, electrolytes, the works.
Got it. And you mentioned kids. Is it mainly children who get this? Any other risk factors the notes highlight?
Yeah, children are definitely the most common group, particularly that sort of 6 to 10-year-old range. Other factors mentioned are things like crowded living conditions, more chance of catching strep, right?
Makes sense.
And obviously a recent strep infection is the big one. It's also noted as being more common in developing countries, perhaps linked to sanitation.
Okay. So clinically, what does it look like? If someone has PSGN, what signs and symptoms pop up?
The classic features, the ones that really point towards it, often start with the urine. Hematuria blood in the urine is a big one. It might look smoky or even cola-colored.
Wow. Okay.
And proteinuria, so protein leaking into the urine too. Then, because the kidneys aren't handling fluid well, you get edema swelling, often puffy eyes, swollen ankles. Hypertension, high blood pressure is really common too.
Anything else?
Yeah, patients might have decreased urine output, feel really tired, fatigued, maybe some flank or abdominal pain. The notes also flag things like headache and specific lab findings like a low C3 level.
Because the complement system's been used up.
Exactly. And a raised ASO titer, which helps confirm that recent strep infection.
Right. So how do we actually pin down the diagnosis if we suspect it based on those symptoms?
You'd start with the basics. Urine analysis confirms the blood and protein. Blood tests check kidney function, things like creatinine levels.
Mhm.
Then those serological tests are pretty crucial, the ASO titer, or anti-DNase B, to prove the prior strep infection. A kidney biopsy isn't always necessary, but if you do one, say if things are severe or unclear.
What does that show?
The notes describe a classic picture. It's an acute, diffuse, proliferative glomerulonephritis. So lots of extra cells growing in the glomeruli. You actually see the immune complex deposits, and on immunofluorescence, they have this characteristic granular pattern.
Okay. So that confirms the mechanism we talked about. Are there other kidney conditions that might look similar?
Good question. Yes, differential diagnoses are important. Things like IgA nephropathy or lupus nephritis,
Yeah.
maybe even rapidly progressive glomerulonephritis could present with kidney issues.
So how do you tell them apart?
Usually the key things for PSGN are that clear link in time to a strep infection, the specific pattern of symptoms we discussed, and those labs, the positive strep tests and the low C3. That combo is pretty suggestive.
Right. So once it's diagnosed, what's the plan? How is it managed, say, here in the UK?
The main approach, according to the notes, is supportive care. It's really about managing the consequences.
So not attacking the immune complexes directly.
Generally, no. It's more about monitoring kidney function very closely, controlling the high blood pressure, often with medication, and managing fluid and salt balance carefully. If there's still an active strep infection hanging around, you'd treat that with antibiotics, but that's treating the trigger, not the established kidney inflammation itself.
Okay.
And the key point the notes emphasize is that, especially in kids, most cases actually resolve on their own with just this supportive care. Specific treatment like immunosuppressants is usually not needed.
That's quite reassuring. What about the long-term outlook, the prognosis?
Generally, it's very good, particularly for children. Most make a full recovery, usually within weeks to months, just with that supportive management.
I sense a but.
Well, the notes do caution that complications can happen. Things like developing chronic kidney disease later on, or even progressing to kidney failure are possible, though less common. This risk seems to be a bit higher in adults, especially if they have other health problems, comorbidities, which is why follow-up is important even after someone seems better. And yeah, the notes package this info nicely for revision recall.
Right, that makes sense.
So it leads to an interesting thought, perhaps for you listeners to consider. Knowing that adults with comorbidities have this higher risk of long-term problems, how might that actually change how you approach the initial workup, or maybe the follow-up plan, compared to how you'd manage a straightforward case in a child?
That's a really good point to ponder. Okay, so that was a rapid deep dive into post-streptococcal glomerulonephritis, hitting the key points from definition to prognosis, all based on those revision notes.
Hopefully useful for consolidating the facts.
Absolutely. Hope it helps cement that information for you. And if you are revising and looking for more great resources like the notes we used today, do check out PassTheMSRA.com and also FreeMSRA.com.
Definitely worth a look.
Thanks for joining us for this deep dive.